These tanks are topped up with liquid nitrogen. They're checked every day.
Inside these barrels, there's hundreds of human eggs that might be born as babies one day.
We refer to it as like the shell.
The shell of the egg.
Yeah.
And just how long can these eggs stay frozen here?
As long as you want to keep them frozen for. So they're stored in a glass-like state, liquid nitrogen minus 196 degrees Celsius.
Egg freezing basically involves harvesting eggs from ovaries, freezing them, and using them later in life.
For some, egg freezing is a way to try and beat their biological clock. But how does it happen? How successful is it, and at what cost?
We asked the medical experts, people who've done this, employers, and the province of BC to find out more. Here at Olive Fertility Clinic in Vancouver, it all starts with a consultation and education.
What's the likelihood or the viability of them to get a reasonable number of eggs?
Then treatment begins with hormonal priming.
It's really a month of hormonal prep with pills, either birth control or estrogen pills.
Next is stimulation.
We do injectable hormones. Women are doing them at home in the morning and at night for anywhere between 8 to 12 days.
And the eggs are monitored as they grow.
We count the number of eggs we see on ultrasound, we measure them, and based upon the size and the distribution of all the egg growth, we determine then when is the right time to do an egg extraction.
After the eggs are taken out, they're frozen at this lab. Now, that's all one retrieval, also known as a cycle, and some might require multiple cycles to get enough eggs.
Now, egg freezing doesn't always promise a baby. It largely depends on the age and the quantity and quality of eggs. But over the last decade, statistics show the amount of people choosing to freeze their eggs has grown significantly.
According to the nonprofit Canadian Fertility and Andrology Society, in 2013 there were nearly 100 cycles. Their data shows almost a decade later it grew to more than 1,500 cycles. And this includes new patients and people returning to do more cycles. But why? One psychosocial researcher says the recent jump could be because people were most isolated during the pandemic and dating less. But this also meant that they had more time to figure out what really mattered to them. And
there are a lot of misconceptions that egg freezer are mainly women interest in career building. So egg freezing is a way that they can sort of spend more time at work and then have kids later. But we now have very strong research data to show that this is not the case. In fact, a lot of women interested in egg freezing mainly because they are single. They don't have a committed partner to build a family together.
Pictures.
This mom can relate to that.
That's the embryo that became REA.
Natalie was 37 when she froze her eggs.
It's kind of late in the game, but I got lucky and I was able to harvest a good amount of eggs, and they produced 2 perfect embryos that became 2 wonderful children. Okay, well, I'm making some pasta for dinner. The turning point was turning 40 and just not finding my partner in life and really just wanting to proceed with having a family and feeling like it was time. My intention was to be a single mom.
For others, egg freezing is more of a safety net.
I actually don't know if I want to have kids in the future, but I also don't want to not have that opportunity in the future.
That kind of thing.
Kelsey is 32. She's a nurse at Olive Clinic and just froze her eggs this year.
I actually found that I had a little bit more of a diminished ovarian reserve than I had thought for somebody that is my age. So that was a little bit surprising for me. I feel like with egg freezing, it kind of gives women the ability to sort of take back some of that autonomy and, you kind of have more control over your future.
But getting that control can be an uphill battle. One of the biggest barriers is the cost.
There's a huge financial commitment that each egg freezing cycle is roughly about $12,000 to $15,000, and it's a very expensive process.
Costs can also depend on the clinic, how many cycles a patient needs, medications to extra lab work. For Natalie's 2 kids,
We are able to at least test fertility and get that paid for with the government, which I think is something that's a good start. But the whole process, I believe, cost about $40,000. Do they have to scream?
in Canada, the cost to freeze your eggs might be partly covered, depending on where you live and the procedure you're getting. Alberta, Saskatchewan, and the Northwest Territories are among the places that don't cover elective egg freezing, according to their governments. Here in BC, the Ministry of Health says it covers many costs related to fertility assessments, but it doesn't cover egg freezing.
Beyond the financial stress, experts say people can often face psychological challenges.
If their body don't respond well, that they have to take more fertility drugs, and ends up that they don't have the expected numbers of frozen eggs at the end.
She says that can lead to depression and anxiety, especially for people who have had mental health challenges in the past. She also says doing the process alone, as many people do, is emotionally taxing.
I felt vulnerable. For my first kid, the whole thing was like just walking on eggshells. I didn't experience a lot of side effects, and the experience did happen very seamlessly. And I know that not everyone has that experience, so I really want to be sensitive to that.
Nothing's really guaranteed, right?
The biggest challenge is we need young eggs, and a lot of them.
In many cases, Dr. Talon says the older you get, the quality and quantity of eggs goes down too, making it more challenging to have a baby.
Less than 35, you get 10 eggs. The projected live birth rate is 60%, so it's not a guarantee. If you're 38 to 40, and the average age of our patients coming in are already 38 years when they're looking to freeze their eggs, if they were to get 10 eggs, it's a 40% probability of a live birth.
So yes, it's a lot of money, and the chances of having a baby might be low, but still, some are willing to take big risks, even just for a chance.
I see women choosing to change their careers. They're looking for companies with extended benefits that help cover either medication costs or potentially the entire treatment cycle.
Here in BC, the University of British Columbia began new fertility benefits this spring, including $40,000 of lifetime coverage for lab services, egg freezing to IVF.
Why was it so important to do this here?
Because it's 2023. Because the university is very interested in advancing the principles of equity and inclusion across our campuses, because we heard from our community members that this was a service that they needed, and we felt that they deserve it.
Here, about 16,000 faculty and staff are covered. And here are some other companies in Canada that offer egg freezing coverage. They're mostly bigger companies such as banks, tech companies, and retailers. But a study commissioned by Organon Canada found of almost 1,000 Canadian employers, most, 53%, do not offer fertility benefits for employees.
So what we found is the majority aren't offering any benefits, but this is a big increase from where we were 2 years ago. The vast majority are only covering the cost of our drugs, right? So while that's helpful, we need employers to be offering more inclusive benefits that cover your cost of drugs plus treatment costs, because when we don't cover those treatment costs, we're still leaving people with huge financial costs.
She says while it can be challenging, it's important to have conversations about fertility between employers and employees.
I can't tell you the amount of people I've talked to who have taken a second job at Starbucks. So people are working 2 jobs just to pay for their fertility treatment by working with companies that offer these amazing benefits.
So benefits can help, but support can also come in other ways.
We need to ask, how come a lot of women feel that they cannot have children earlier? Okay, and we need to have more open discussions about social policy, how to support women having children earlier.
Yi says there also needs to be more support for single women who want to have children on their own,
so that they don't think of egg freezing as just as a sort of a get it done as a backup plan. They're always proactive in having children, always proactive in thinking about the childbearing plan, about the family building plan, so that they don't even have to do egg freezing, and they feel they can have children whenever they want to have.
Now, egg freezing can work. It can give hope or be a big question mark with no promises. Really, I guess it's asking what you want and what you're willing to go through to have a child. Baneet, Braich, CBC News, Vancouver.